Welcome everybody to GW, University Center for Integrative Medicine YouTube channel. I'm your host, Dr. Kogan, Chief Medical Officer of the Center and Associate Professor of Medicine in Division of Geriatrics and Palliative Care. I have been involved in Maryland Healthy Aging Initiative for quite some time. There's the government-sponsored initiative that basically said, look, how can we improve aging in our state? In state of Maryland, there's a pretty significant percent of patients who are over 65, or I'm sorry, people who are over 65. And I think I'm very proud of my own state where I live, that there is an attempt at saying, what kind of infrastructure should we build for this population? And so when this article that I'm about to talk about came into my inbox from a friend of mine, Andre, I immediately thought that I have to discuss this and sort of share my opinion about this, and also just talk in general about this really important topic, use of technology by someone who is older adult. So, my parents are close to 90. They're using some technology, but obviously they're struggling with some aspects of it. And so I think this topic is also very personally important to me as well. So without further ado, what I'm going to do is go ahead and share my screen with you and put the study, and then I'm going to discuss the study, and as you have it on your screen. So this was published in JAMA, and for those who are interested, JAMA Open Network means you can always have an access to the entire article. So you don't have to worry about sort of looking carefully at what I'm about to show you. You will always have access to this, and I, of course, will have the link to the study in the description of this video. So this is a standard survey. It's a pretty large survey that was conducted for people who were between age of 50 and 80 under a national poll on healthy aging that was conducted in August 2021. So I'm not going to discuss nitty-gritty of some statistics, some issues. I think what I decided to do, I'm first going to show you this table. So this is a table number 1. And it's broken down in multiple different categories. So you have a use of technology. And by the way, this is defined as a digital health technology. So basically, what are we talking about is mostly telemedicine, right? Because this is the critical aspect. If somebody can use the telemedicine in a moment when they can't physically go to an office, it becomes one of the most important aspects of access to healthcare, right? So they put patients in categories by 10 years, so from 50 to 60, 60 to 70, 70 to 80. Interestingly, I thought there was a weakness here, and they didn't include people over 80. So we're going to have to guess that there's a trend here. As you see, the trend is obviously down, as you would intuitively predict. The younger the person is, the more likely they are to use technology. Interestingly, women generally use technology more. So you can see here on average, if 47% of male were using it, device and using digital health technology also. And by the way, of course, this number is going to be very close simply because you can't really use digital health technology without use of some kind of device. I think that's self-explanatory. They can be identical. I mean, they could be close, but yeah, they're going to be close. So the race played a really big role. As you can see, Blacks and Hispanics had substantially, we're talking 6-fold lower utilization. And obviously, what I'm also going to point out, which is probably most important, in addition to age. So age was a critical factor. There's 2-fold here. The younger you are, the more likely you use. But here's another really important one. So, patients people who were surveyed who were over $60,000 a year annual income were more than 2.5 times likely to use the technology compared to someone who was making less than 30,000. So I think this some of the most essential or most critical aspects of this study. And you can also obviously also look into some other categories. They reported a lot of data. For example, they reported if you are in excellent health, like relative to other people, and so they compared all this together. So this is the use. So it's actually interestingly, there's no exact correlation. So if you're really poor, then you're not going to use it if your health is really bad. But there are some differences here, but I would say they're much less significant compared to the differences from age, race, and income. So I think those are the bigger ones. So people were using Portal, significant percent on average, of those who use the technology. More than 50%. And there's so different breakdown of different things. I kind of find it interesting that there were people using it for diet advice and exercise. So that's good to see. And it's not a small numbers, 20 and 33%. So I'm going to stop at this. I'm going to stop sharing, and I'm going to just give you a little general review as to what I think all this means. Did I stop sharing? I think I stopped sharing. Yeah. So what does all this mean? Well, we know that not everybody using the technology. We know that in order to have an access to telehealth, in order to be able to navigate some of this newer ways of delivering of healthcare system, people have to have some equipment. They have to have device, right? But I want to take this to the next step. So what does this mean? If we know that by the age of, let's say, 70 or 75, somebody with a low income, they're only 20% of all those people are using technology. What this means is that there is a dramatic increase in overall use of technology in healthcare. We have wearables, right? So the devices, I'm talking while I'm wearing this little Aura ring that assesses my heart rate, how much I moved today, how I slept last night, and all these things, right? So, there are all these different ways our healthcare data and healthcare interaction with the healthcare system is happening now, and it's going to be rapidly becoming more and more technology heavy. We will be likely treating most of the conditions with some kind of an AI-assisted technology that from patient side will be required to have that piece, right? So there basically will be critical that the patient has capacity to use a device. I think it really matters whether it's a phone system or a computer or a tablet, but they're going to have to use something in order to interact with that aspect, and then that will interact with the doctor, with their doctor, with their healthcare facility. So in essence, we're leaving behind a huge proportion of older adults, and that's a factual information. We are leaving behind people who can't make enough money to purchase the devices and learn about it, or simply that they are not even aware of some of this because their access to healthcare is so poor. And of course, that affects mostly minorities. So I think the reason I decided to make the video has more to do with not just equity and the fact that, if you're a rich white person in this country, you can buy yourself all kinds of stuff, all kinds of access to healthcare. But really has more to do with the fact that knowing this fact, we have to adjust accordingly. We have to understand that in order for us to continuously improve healthcare of our older adults, we have to take this into account. There have been attempts in different states to account for that. Like even in our own state, when we had these discussions, we had actually had many meetings with a large group of experts and different consumer groups, et cetera, who were really trying to figure out, how are we going to improve the healthcare delivery, in essence, and infrastructure for health in Maryland for older adults. So we discussed this, and it has to happen at every level of society. Starting from all the way up higher politics on the federal level, all the way to the different locations. And I think it can be done. I think it must be done. We know that we have to engage into these systems, and from perspective of market, they're going to be here. They're already here. AI is rapidly integrating itself into the healthcare system delivery. So there's no reason to think that somehow, particularly in geriatrics or healthcare for older adults, that's going to be different. It's not going to be different. But it will be a struggle because, how do you assure that the patient you're trying to work with through whatever your EMR and however you have a complexity of AI supported delivery of healthcare, if the patient on that other end is not able to have a basic device, you leaving that patient behind. So one unfortunate thing that I'm seeing, and I'll just give you an example from both of our practices, so from university practice and from my private practice or from our center. And in the center, we're seeing a lot of older adults, right? We're seeing, good, I don't know what percent, but probably at least a quarter, if not a third. But in order for them to even come to us, they have to use the technology, right? They have to fill out the intake forms online, and they have to fill out very complex questionnaire and consents, and it's 100% electronic. In the past, we had a paper form they could do, but not anymore because the intake process starts with a 5-minute online questionnaire. And we have some patients who family will help or etc. But obviously, it's a huge bias, right? So the people who I'm seeing in our clinic, in our integrative medicine clinic, if I'm seeing them, it means they have an access. So they already set this up. But in university, we do regularly see people in person who don't have access to this. Like they can't set up telemedicine. If I try to tell them, look, let's do a continuous glucose monitor and use your phone, they're not going to be able to do that because they don't use that. And it may come as a surprise to many of you listeners, because you would expect that, just think about yourself, like, can your parents or your grandparents use this? And I'll tell you, my parents, they're using a cell phone. My dad is using computer. My mom is using computer. But there is no way that my parents would be able to set up a continuous glucose monitor unless myself and my brother helped them. And the same exact true with telemedicine visit. So it's a big problem. It will be really interesting to see how it evolves. I do think it will rapidly evolve simply because of necessity. I also, it's also a call for action. I hope I'm recording this message in January, well, at the end of January 2025. I just want to put the timestamp here, because I do hope that on the high level of politics, Center for Medicare, Medicaid Services, there should be some way for the system to aggressively encourage adaptation of the telehealth and technology, in essence, in delivery of healthcare to an older adults. And I do think that it's critical, not only from that perspective, but also that in the future we'll automate and optimize so many pieces of delivery of healthcare. Like, just a very simple example. Right now, I've struggled today. I had to organize an order to be sent to a pharmacy for a controlled substance drug, and there were some glitches in the system, and et cetera, et cetera. So all of that can be completely automated. There's no question about that. The systems that we deal with are going to continuously be improved, but they also need to be continuously adapted to this sort of population that has hard time reaching into the system from their other end, from the consumer end. So stay tuned for more. Links is going to be in the description. Of course, I will put that. And we'll see you soon. I hope that this was informative, and stay well, and please take care of our elders. They are, no matter what our society in America thinks, they are the wisdom keepers, and their value is highly undervalued and critically important for the future generations and even for current generations. Thank you so much. Take care. Bye.